colleagues, and to the listening audience. We have on the agenda Bill number 103-36 COR is introduced by Legislative Secretary Senator Shelton, myself, Tina Muña Barnes, and Senator Mary Camacho Torres, which is an act to add a new Chapter 29 to Division 2 of Title 22 Guam Code Annotated relative to telehealth and telemedicine services during public health emergencies. Joining me here this afternoon is Legislative Secretary Senator Amanda Shelton. Thank you for joining us. And I see Senator TELEHEALTH. Good afternoon. Thank you for joining us. The conduct of this public hearing, I'll do the rules of engagement, shall be as follows. Those testifying will be recognized in the order of the sign-up sheet, sign up on the sign-in sheet. Written testimonies may be read. In the interest of time, I will ask testimony to be summarized to about 5 minutes. I would adhere to that timeline. Written testimony shall be submitted to the committee. Please provide our legislative staff with your written testimony for photocopying and providing to our colleagues. Testimony shall be confined to the substance of the bill only. Persons will be allowed to present oral testimony only once. Once you are done, you may be asked to remain in the room for questions or for additional testimony as may be desired by members of the panel. Proper form and decorum shall be practiced by all present in the public hearing room. For the proceedings, individuals who do not comply may be escorted from the public hearing room. When you speak, please make sure that the microphone is on and that you speak into the microphone, and you can see the red light will be on. Please state your name for the record and where you're from, and if you support or do not support the bill during your testimony. Those who do not follow these rules of engagement will be removed from the public hearing room. With that being said, we will now move to the item on the agenda, which will be Bill number 103-36 COR. Amender. Oh, I do apologize. I was just informed that also joining us this afternoon is Senator Mary Torres. Thank you so very much for joining me. At this time, I will yield to the Legislative Secretary, Senator Shelton, for her opening remarks. You may proceed.
Sidious Masi, Madam Chair, thank you very much for convening this public hearing and for hearing this bill promptly. Madam Chair, there's no denying that the COVID-19 pandemic has significantly impacted our island's healthcare system, reorganizing hospital and clinic procedures to promote adherence to social distancing measures and limit potential exposure to patients and providers. This has been a great priority for everyone in our healthcare community. Furthermore, community health centers, CHCs, under the Department of Public Health and Social Services are the only federally qualified health centers on Guam serving a patient population that is 95.7% uninsured, underinsured, on Medicaid, or on the medically indigent program. The CHCs serve many patients with chronic medical conditions, and such patients who may have limited health literacy require frequent visits in order to maintain a state of good health and would benefit from additional telehealth check-ins via telephone. Bill 103 will serve to decrease the number of face-to-face patient visits at our island's healthcare institutions, and thereby also limiting exposure for healthcare staff and patients, and conserve our PPE and cleaning supplies. The pandemic has also placed a strain on the continuity of care for our residents, as many of them were restricted from traveling to receive off-island medical care. Recently, the government of the Republic of the Philippines has suspended the entry of all foreign nationals in an effort to mitigate the spread of COVID-19 in the country. And as we know, many of our island residents have in the past sought medical care in the Philippines, as well as places like the state of Hawaii, who still have very strict restrictions on incoming travelers. These restrictions from jurisdictions frequented by our people for medical care, though warranted and necessary to ensure public safety and health, have presented very costly barriers to off-island medical care for our people. For the benefit of the committee and the public, I'd like to take a moment to define the following terms for our discussion this afternoon. Telehealth is a broad collection of electronic and telecommunications technologies that support healthcare delivery and virtual medical health and education services from distant locations. And telemedicine is the practice of medicine using technology to deliver care at a distance. It occurs using telecommunications infrastructure between a patient and a physician or other practitioner licensed to practice medicine. Madam Chair, I once again am introducing this measure to continue our island's efforts in limiting potential exposure of patients and providers to COVID-19, preserving Guam's personal protective equipment and cleaning supplies, alleviating the patient caseload at Guam's healthcare institutions, and providing an avenue for insured patients to seek less costly medical care. Bill 103 also allows for the provision of telehealth services by professionals who hold active licenses to practice outside of Guam in consultation, and only in consultation with on-island professionals who have ultimate authority over the care of patients. In this way, insured patients can avail of services while also protecting our local healthcare industry. The measure further puts in place a reimbursement scheme for insurers for the telehealth diagnosis, consultations, or treatments of patients equal to coverage for the same services through face-to-face consultation. These provisions further solidify mutual agreements between healthcare providers and insurance companies to develop acceptable payment rates and methodologies for telehealth and telemedicine services. And Madam Chair, as you may recall, in the last legislature, it was really our hope that during that time, we heard from some folks on a very similar bill to this, that the free market would dictate the improvements needed to our healthcare system, the improvements that were necessary, the adaptations that we would need so that telemedicine and telehealth would be covered by all insurance. And we're learning now, over a year into this public health emergency, that there are still concerns from our constituents that telehealth and telemedicine is still difficult to obtain and be covered by insurance providers. So I'd also like to bring to the attention of the committee that this bill would only apply during public health emergencies that are declared by the governor on Guam. But I also welcome the discussions today on the bill's application beyond public health emergencies, as we're all seeing the increase in the demand for non-face-to-face consultations. I know we've heard over and over that COVID-19, though we've been making great strides with our prevention measures, with vaccinations increasing every day, that COVID-19 is not going away anytime soon. And the way that we've began to live life now is our new normal, with social distancing, with as much virtual interactions as possible. At the end of the day, Madam Chair, this measure seeks to facilitate the continuity of care for our people, especially during these unprecedented and very difficult times. and protects both our patients and our healthcare providers and staff. This pandemic has made us realize the urgency to develop and improve our healthcare system to meet the changing needs and demands of the 21st century. We need to do all we can to ensure that we are not left behind. So I thank you very much for this opportunity, and I look forward to the testimonies that we'll hear today, the discussions to strengthen this bill and move forward. Sitios Masi, Madam Chair.
Sitios Masi, Legislative Secretary, Senator Shelton, and before I move any further, I see the presence of Speaker Therese Terlahi and also Senator Pito Terlahi here this afternoon. Thank you very much for joining us. I will note for the record that Director of Guam Behavioral Health, Mrs. Teresa Ariola, sends her apologies for not being able to attend today's public hearing. However, she shared with me personally that she rises in support of the measure and will be sending her letter of support and possible recommendations on the efforts of this bill. And I understand that we also have word from Dr. Shea, who could not be with us, who says he supports the bill, but wants all telehealth to be covered overall through all the necessary areas. So his statement specifically says we need to ensure telehealth is covered regardless of a state of emergency, especially on remote islands such as Guam. Not concerned about controlled substances. All prescriptions must be filled by a local provider. Thus, all telehealth will work in conjunction with local prescriptions. Thomas Shea, MD. Thank you very much. I just wanted to make sure I read that into the record. And then I do have some folks up to testify. And I'll start with Mr. Chima from the Department of Public Health and Social Services. Thank you for joining us.
Thank you. Good morning and good afternoon. I'm here to support the bill for the continued use of the telemedicine for the island. I have a written submission by Dr. Kenichiro, concurred by the Director of Public Health, Mr. Adsan Augustine, from last year. And I also want to support the bill with evidence from the TB program. I was the TB program manager from 2018 up to now that I'm still acting as the Chief of Public Health. Guam was the first island in the Western Pacific to use the asynchronous video directly observed therapy for TB treatment. And at the NTCA conference in 2018, we presented a poster showcasing how much the government of Guam saved from using the asynchronous video directly observed therapy for TB treatment on the island. And basically what it means is that when patients have an option to telemedicine, it actually supports the fact that it will reduce the cost of transport for them. It is a cost-saving approach for both the patient and for the government in the sense of the government facilities. Also, there is also continuity of care beyond diagnosis. All throughout treatment, the individual would not have to pay visits to the clinic, but the care can be continued through the telemedicine. Also for follow-up care. You also look at some of the illnesses that have a long length of treatment. Introducing telehealth as a support to the individual would actually help them, especially those that are bedbound or those that are at home. They can use telemedicine to actually interact with their medical professionals. So I think I can submit an estimate of the savings that has actually occurred between the Guam tuberculosis program, by just using the asynchronous telemedicine for treatment as evidence to show that even in the time of non-emergency, telemedicine would greatly help the island. Thank you.
Thank you. Just a couple of things, Doc. Mr. Chima, if you said you had a presentation from Dr. Kaneshiro?
Yes, it was a written testimony from last time.
If you can, oh, okay, okay.
Yeah.
And if you just can submit a copy again, just to make sure that there's a copy, I would appreciate it. Thank you so very much.
Thank you. Ma'am.
Now I will go ahead and address Mr. Konda. State your name for the record, please, and where you're from, and if you support the bill or not support the bill.
Thank you. Thank you, Vice Speaker and Senators, Speaker Tolahi and Senators of the legislature. Thank you for the opportunity to speak on this bill. GMHA, we have some oral testimony. We don't have any written testimony prepared for today, but we do have oral testimony. And so with me is Don Rabanald and Paula Manzan. They are key to our information technology program at GMH, and so they'll be speaking on the bill. We do support the intent of the bill, but we want to provide a little additional information as well.
Hi, my name is Paula Manzan. I'm the clinical nurse informatics supervisor at Guam Memorial Hospital. We have been building our telemedicine program at the hospital, and I think we fully intend to support this bill. Right now, we have one ICU intensivist, Dr. Ugin, and being able to support her and have her, give her support in regards to clinical manpower to take care of all these COVID patients, as well as our regular patients in the ICU. We were able to build a program of ICU intensivists who are taking care of our patients from Friday to Sunday in the ICU via telemedicine. We have a telemedicine rounder that goes hand in hand together with our telemedicine technicians, and they push that telemedicine rounder to see each and every ICU patient and take care of them for that particular shift that we're covering during the weekends. So we plan to expand our telemedicine services to other parts of the hospital, not just the ICU, our inpatient services, and most definitely our outpatient services as well. We also had plans, and we wrote a grant last year to kind of make a plan for outpatient services that involved DOC, UOG, distance learning, and telemedicine health services as well. So we're definitely making strides to improve telemedicine services on the GMH side.
Good afternoon. This is Don Rabanald, Assistant Administrator for Admin Services from GMH. Good afternoon, Senators. Thank you for giving us the opportunity to echo support for this particular bill. As mentioned earlier, we have been living telemedicine, telehealth at GMH. We initially launched outpatient services via telehealth, telemedicine services, simply because we closed our doors and suspended outpatient services, which resulted to, we wanted to close that gap to make sure that our patients are still taken care of on an outpatient setting regardless of the situation. And we were able to successfully launch that last year for rehab services. And we were well in the way to launch that with special services as well, so the other specialty clinics of the hospital. So Paula mentioned ICU. ICU is our big inpatient services where we are utilizing telemedicine services from providers, well, 3 or 4 different providers. Just to give you guys a perspective, our ICU prior to COVID census. The IC was running at a 6-bed non-COVID census prior to the pandemic, and right now we're holding our ICU capacity to 14, if I'm not mistaken. We are starting to try to taper it down, but the presentation of our patients at the hospital is still non-COVID, but a lot of them are getting very, very sick. So telemedicine services really allow the hospital to expand services and allow additional bed capacity for our patients, for our community. Thank you.
Thank you, Mr. Dan. Ladies and gentlemen, I do have one more individual who would like to present testimony. So, Bill, if I may just ask you to just switch right now, but if you could just stay just in case any of my colleagues have any questions, we'll call you back in. So, Sergeant of Arms, if we can just bring the other one in. Okay. No. Hi, Mrs. Espinoza.
Hi, good afternoon.
You may proceed at this time. Thank you. You may proceed.
My name is Maria Espinoza from Manilao, and I'm here to provide, I am in support with the bill, but I do have some comments to make. I haven't really read it as well as I could. I just found out about it today, but I felt it was important to come. Telemedicine has always existed. You know, we don't ever recall it like that, but it has. Why can I say that? Well, if I need a prescription from my doctor and he writes it out, I can ask him to fax it to the pharmacy of my choice. That's telemedicine. And I take advantage of that all the time, because why do I want to go drive to the doctor, get my chair, put in the trunk, drive to his clinic, blah, 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 when he can fax it directly to the pharmacy of my choice. Excellent. And then on the opposite extreme, I took care of my son, who was bedridden for 8 years, and especially the last few months when he needed stronger painkillers, the stronger ones where you can't just go, it's not over the counter. I did not have to go personally to see the doctor. The nurse came to the house and was able to see that he needed stronger medication, pain medication, called the doctor, he prescribed it, and then told me I had to go and pick it up. That was the only inconvenience, was I had to go and pick it up. So telemedicine is good. It has its goodness. But when I read this bill, though, it starts out saying that it's relative to telehealth and telemedicine services during public health emergencies. So kind of the tone doesn't reflect the intent of the bill. As I read along, it's a little too general. And these are my recommendations, even though I'll follow it up with more because I really didn't have that much time to go over it. the first page is very general. It's your intent and your findings and intent. But as I said, it doesn't reflect the tone of an emergency. It's more like for general uses, and that there's when the bill is so specific, there's a tendency to take advantage of the language which is not specific enough. And so on page 2 of the bill, line 12, I'm going to have to go up to 10 and just read the whole short paragraph. The legislatura further finds that CHCs in the process of upgrading patient health, using video conferences, which will decrease the demand for face-to-face clinic visits on Guam. We must be specific to confine this telemedicine on Guam. Because otherwise, then we're going to get out of control, and we're going to be having doctors that maybe we're not too familiar, getting all kinds of communications that way. We must be specific to limit it to Guam, where our doctors are going to be able to conference with us, however medium we decide is best, to limit the demand for face-to-face clinic visits. That's absolutely necessary, and we have been doing it. Because if I had to take my son on a bed, order ambulance service, if it's by appointment, I would have to pay cash. It's not emergency. I would have to take him on an ambulance, and they charge up to at least $300 for round trip. But my point here is this telemedicine should be limited to the doctors and their patients on Guam. And I'm sure there are other lines within that page too, but like I said, I haven't really taken the time to go line by line. And then on the definitions, once again, the first definition is telehealth on the third page, line item number 18. We must add, the last, actually begins on 18 and ends with 20. Line 20 says medical, health, and education services from Guam, distant locations on Guam. And again, the next line, B, telemedicine means the practice of medicine using technology to deliver care at a distance within Guam. And on and on. As I mentioned, I haven't had the chance to read everything. And to include on page 4, line number 6, again, using related services using telehealth on Guam, or something within that kind of language. Okay. I will review the rest regarding the insurances, because I do have a lot of experience with my son and the way Medicare works and stuff, so I am really interested to sit down and look at it a little bit better. I am happy to see that it was included. My examples that I gave, and it starts on number 4, the treatment of, letter C, a telehealth provider shall not use telehealth services, blah, blah, blah. And it does exempt on page 5, number 3, the treatment of a patient receiving hospice services. And that definitely has been addressed with, while I was taking care of my son. He needed those painkillers urgently, and the doctor was able to prescribe it, and I was able to pick it up. So I'm happy to see that that particular line item is included. And so thank you for the time for allowing me to be a part of this testimony, and I will follow up with an email. How many days do we have to 10?
10.
10 working days or
10 days.
10?
Uh,
Monday to Friday?
The record will be open for 10 days.
Okay. Consecutive days as opposed to working days?
I would just say 10 regular days.
Okay. Unless there's no questions, thank you for the time, and I'll leave now.
You're very welcome, Mrs. Espinoza. And at this time, the author said she's willing to close, so Speaker Therese Terlahi, I will acknowledge you at this time. Do you have any questions for the panel? I will note that there are 2 other members from GMH, and if anybody wants to address them, just let me know, and we can have them come back in. Yes. First of all, Speaker Terlahi, you are recognized.
All right, thank you, Madam Chair. Yeah, I was hoping that the insurance companies would be here to testify. I want to clarify some questions that linger. And as we know, in the beginning of the pandemic, there were many concerned about ensuring that telemedicine was allowed so that they could all avail of it. And I remember at the time calling every single insurance company to verify whether they were covering this or not, and they all eventually said yes, they were. And so it was the testimony, and the last time a very similar bill to this was heard, that they were covering this, and that and I think I hear from you, Mr. Chima, that public health, I mean, it was their testimony, Dr. Kanashiro's testimony as well, that they are definitely using that in the community health centers. And we hear today that they are definitely using this at GMH already for ICU and trying to expand it to other areas. So the bill says that the Guam Board of Medical Examiners shall seek approval from the department to practice telehealth and telemedicine services in Guam, meaning the Department of Public Health. And this shall apply during public health emergencies. I guess I just wanted clarification because the testimony was, before and now that they are allowed and they are practicing telehealth and telemedicine during this pandemic emergency at the very least. And Mrs. Espinoza, or Mrs. Yes. Maria Espinoza, yes. I very much appreciate your testimony. Did you want to add something to that? Please
yes.
do.
Can you hear me?
Yes, I can.
Yes, I'm glad that you followed through with because it made me remember I still owe GMH about $2,000 because I did have the COVID. I was in about a year ago in March. So Medicare paid their 80%, and I was left at the $2,000. And I'm thinking, since the circumstances were under COVID, that really I should have gotten a break with that $2,000 and had that portion paid by COVID-related expenses. But I don't know,
Under Medicare?
Medicare already paid their 80%.
So by who? GMH itself, or do you have an additional insurance?
Yeah, I was at GMH. I went through the whole process, yes. And I was still left with about $2,000, and I was wondering, because Medicare paid for their portion, because I have Medicare, but my portion was $2,000. And I was just wondering if anybody did show up, if you could ask them that question. Could I refer the balance of that bill as part of the Medicare, a COVID-related expense? Because otherwise I was a healthy person.
Well, I don't know the answer, but Mr. Kondo is here, so you are in luck. He is going to take that up, I'm sure, and probably can get back to you. Is that right, Mr. Kondo?
Yes, Speaker. As we all know, we don't get reimbursed fully for patient care, and for those expenses, there are expenses that fall on the patients that were COVID-19 patients. That's true. Again, we're trying to do this as a whole community to be able to provide health care and to be able to afford health care going forward, and that's the support that GMH requires. We cannot cover every expense.
Thank you, Bill.
Thank you.
Okay. I'll go outside and listen to the rest for a while so somebody else can come in.
Oh, I think there's no one else, so you can just stay there if you'd like. Yes. Right. And so, okay, so my questions really were, so, is the change necessary if it's actually already being done during a pandemic? And I think we also have a statute that allows some type of telemedicine for the Board of Medical Examiners to, regulate in consultation with local physicians, though. It looks like to me at this point, and I'm not sure if that needs to be expanded, but currently there is that capacity. And I was wondering if this should be mandated on every insurance company or made optional for the insurance companies to cover. They've already said, I think they've said that they're mandated even by federal law at this point to cover this for this pandemic. My other question was whether physicians were equipped, because we received testimony that they were making themselves equipped, as we went along for telemedicine, and I think that's our experiences. This pandemic really boosted every provider to look at the possibilities of some type of telemedicine, especially locally, right? Local to local.
Right.
Local to off-island. I agree with you, Ms. Espinoza, that should be considered as well, but maybe separately, because that's a whole other, then there is no local provider who is following you and your health, right? Unless they are mandated, as the current law says, to partner or to consult with a local physician while they do that.
Right.
And I think that's how you're doing it at GMH, is that right? That they're partnering with the current ICU, Dr. Jolene, or are they independent of her?
They are, yes, Speaker, thank you for that question. They are collaborating with Dr. Uggen, but again, our whole focus for COVID-19 was predominantly ICU care, and it started with the Naval Hospital, the Naval Medical Center out of San Diego. We were partnered with them in using their telemedicine program and their telemedicine physicians and professionals collaborating with us. But we could only use it for so long. They were trying to wean us off of that. And so we were fortunate enough to be able to migrate, transition to DOD physicians that were with us during COVID, that when they went back to the mainland, we were able to hire them as independent practitioners. And so we're able to do our telemedicine program to be able to link with them, to be able to link back with us, Dr. Uggen, and they're able to call in a lot of times and communicate with our nurses, our ICU nurses, so that Dr. Uggen can actually get some rest.
Yes.
And so without telemedicine, an effective program, long distance, because we're geographically isolated, and we're also limited with our physicians, especially our specialized physicians. And so that's what's allowing us to sustain our specialized care, is to have this long-term, long-distance relationship. I do believe that the telemedicine, some of our services lend more appropriately to just on Guam, outpatient services, and it allows us to link the network, the continuum of care. That's where we were heading even before COVID, and that's where we need to continue to go, to link with the healthcare clinics of public health, to link the entire network. That's one of the ways to do it, is through telemedicine locally. But I have to fight and support. It's also we need it long distance as well.
Yes, and I think I'd like clarification, because the way I read the statute is that is already allowed, right? And so that's why you are able to do it, as long as they are consulting with someone local who has their eyes on that.
Yes, Speaker. And actually, even before ICU, we've been doing telemedicine for a long time.
Yes, and I definitely agree with you as to the need for specialists, especially to be able to consult with our.
Yes, even our radiology department, we have a PACS system, which is a patient archiving system that allows us to share our radiology images long distance. It's, because,
Yes.
and that's how we're able to grow our radiology care as well.
Right, and I know a lot of that is being done already prior to the pandemic and now.
Exactly.
So, yes. And so I guess, yeah, my other concern was, we don't have any Board of Medical Examiners people here today, but yeah, whether this says that they may or they shall seek the approval of public health. It's mandatory for a new telehealth and telemedicine service in Guam, but I guess I would like clarification how that is going to depart from the current statutes. And then, as you know, Madam Chair, I had also just issue regarding the referral of the bill, that this bill does not affect only the government of Guam's health insurance contract. It affects all insurance policies on Guam, and therefore it has the potential to affect all patients and healthcare in general on Guam. And I agree with the benefits of telemedicine, but I just think it should be reviewed in those parameters, Madam Chair, and thank you. Thank you to all of you.
Thank you, Speaker Chirlai. At this time, colleagues, I'm going to go ahead and ask if anybody has a question for Mrs. Espinoza.
Yes, this was one other thing I didn't have time to write, is we really need, first of all, I really wonder what's the effect of having a bill when it's so specific to emergencies, when we agree that we have been having telemedicine. But the other thing that concerns me is there's no definition of when the emergency ends. Are you going to go under the CAR scores? Are you going to go under what? Under what? We need to put a definition in here of when it ends. And I think I'll end. That's my last suggestion.
Thank you. An emergency is declared by the governor, working closely with public health based on Chapter 19. But at this time, colleagues, thank you. Are there any comments or questions for Mrs. Espinoza at this time? If not, I will go ahead and thank her and excuse her if there's no other questions or comments. Thank you very much, Mrs. Espinoza. You may be excused at this time, and then we'll go ahead and bring the other panel members back. Thank you, Mrs. Espinoza. Mr. Conda, you can. Mr. Conda, I think they have a question for you. We'll just excuse Mrs. Espinoza. Thank you. Next, I have Senator Taitigui and then Senator Torres. Senator Taitigui, you may proceed.
Madam Chair, for the opportunity to ask questions this afternoon. And I, too, was concerned about not having the insurance company here today, though I'm going to probably, for the record, make some comments and hope that the insurance companies, if they're listening to this, they can provide the answers and maybe provide it later on in a testimony. But so the section in 29.3, and I'm hoping that maybe Chuma or maybe Gmh can answer this question, or any of the panel. With regards to this section 29303E, it says a non-physician telehealth provider using telehealth and acting within his or her relevant scope of practice as established by Guam law or rule is not in violation of the practice of medicine or austerity or any attempt to practice medicine or austerity without a license to practice in Guam. That's what it reads in this section E. So my question is, what is a non-physician based in this legislation, what is considered a non-physician? Is it a nurse practitioner, physician, assistant, certification? Is your interpretation of this legislation as a non-physician, including these particular occupations?
Mr. Chima, or anyone at GMH who would like to give an example?
I can answer to that from the perspective of the TB program. So we have the communicable disease control staff that actually support the medical provider and the nurse to do directly observed therapy for TB patients. So what they basically do is they take the medication to the patient that is prescribed by the doctor, and they watch them, observe them ingest the medication. So basically, the medication is actually prescribed by a doctor, but what they do is ensure that the patient takes the appropriate, the prescribed medication to mitigate against the spread of infectious disease on the island. So in that instance, they are not medical providers, but they are actually using, for us now, we do it with the asynchronous, directly observed therapy, where they provide the medication to the patients and observe them ingest the medication over the internet. So we actually do that. So I think that might be part of the description of non-medical personnel who actually use telemedicine as part of their scope of practice.
Thank you, Chima. GMH, did you want to comment?
Yes, Senator. In the case of GMH for telemedicine, we definitely have. Is yours off? We definitely have. So we have physicians speaking to nurses, long distance. We also plan to expand that out to include, we're hoping to expand that out to include outpatient services in the future, locally here on Guam. So outpatient services would be including allied health professionals. So it could end up being a very wide range besides just physicians and nurses that we want to be able to participate in telemedicine and telehealth.
So my concern too is on how are liability issues going to be addressed on the liability perspective in determining, those who are providing this telehealth. If it's not a physician itself, do you see any issues with the, addressing liability?
Well, I know in our telemedicine program, for example, the physicians, it's written into their agreements the liability, the coverage that they have. A lot of them they have coverage, but we're also providing them coverage as well. I guess the question is the liability on the non-physicians. That I'm not sure of, and maybe that needs to be looked in a little further.
Ma'am, good afternoon. So as far as GMH implementation of telemedicine, telehealth is concerned, we have always stayed within the scope of practice. Doctors would have to be licensed as far as Guam licensure is concerned. We have rolled out, as mentioned earlier, for outpatient services where rehabilitation therapists have called out to our patients and did consultancy sessions with them, all the way to exercise, range of motion, so on and so forth. But we have continued to maintain the scope of licenses that we have for our staff. So I just wanted to share that. So that is not that's not an issue for us.
Thank you, Dan. Ms. Fuller, you have a comment?
So the credentialing processes are the same. They go through the GMH credentialing process in the same way. They apply. We are in coordination with the board the board for their licenses and all the needed requirements that they need to do. And if of course, they're off island, so they would send all of their stuff to the board. And we wait for those approvals, and they can't start without them.
That's good to hear on waiting for those from off island. I appreciate it. On page 9, line 2, this section here, what is considered technical fee?
So in the healthcare billing, RCM, revenue cycle management, ma'am, there are usually two types of fees. One would be professional fee, that is the professional charge for a doctor, for example. For reading a radiology image, for example, that's a professional fee according to the doctors. The technical fee is the procedure fee or facility fee. So that's all the expenses related to providing that diagnostic service. So from the X-ray equipment, the personnel, depreciation, so on and so forth, that's lumped in together. So that is what's referred to as a technical fee.
Okay. The other question is, I think this will go to GMH. Are costs associated with providing telehealth and telemedicine service different from those offered in person?
The cost, ma'am?
Yes, associated. Is it different on telemedicine versus in person?
Well, I would say there's a difference because that provider is actually off island. As opposed to if you're recruiting somebody to move to Guam, the cost would be definitely higher. One of the magic or the blessings of telemedicine is to be able to open up our island to missing or absent specialties that is prevalent, that are available off island. So being able to do at least preliminary work for our constituents here before sending the patient off island for care, stateside or wherever. That's the initial magic of it. So cost-wise, I would say there's great difference between face-to-face and telemedicine. But of course, there's only up to a certain degree of patient care that you could provide with virtual care, as we call it.
Thank you for that. So just to clarify that, let's say an individual patient here on Guam, instead of going into the doctor's office, decides to do it through telemedicine. In fact, I've done it myself with my doctor. Instead of going in, I thought it was more convenient just to go through telemedicine. Is the charge the same? I know what you're saying, about going off island and with specialties, and that's why this bill is important too, to provide that services that people who can't afford to leave off island. This is an opportunity, but I'm talking about just here on Guam. If an individual decides to use telemedicine, instead of going into the doctor's office, is that cost the same? Or is it less if you go through telemedicine?
Senator, we certainly work with our finance folks to verify that.
Okay.
I don't believe that we're maintaining a certain level of care. That level of care is not decreasing as a result of telemedicine. So in the case of the ICU, I don't think our ICU care, our charges are decreasing. I believe they're being maintained, but I would want to verify that through our CFO.
Okay. So is it known if the health insurance companies and healthcare providers in Guam do you know of any that do not cover telehealth or telemedicine?
I'm not aware of that.
Okay.
Thank you.
Madam Chair, I'll reserve my time. I know there's others asking.
Thank you,
if I
Senator.
can. Thank you. Thank you.
Senator Mary Torres, I will recognize you at this time.
Thank you, Madam Chair. I just want to thank the panel for the discussion because you brought up a lot of points that I think were important to emphasize. One is how telemedicine is really a program that you're developing to help enhance your delivery of care in terms of access to specialty care that is not abundantly accessible on Guam, how this has actually caused you to save some money because not having somebody in the facility is less costly to manage than going through telemedicine. But I think what you touch upon also is the fact that telemedicine is more or less the wave of the future, and how that is one way. Mr. Chima, when you're talking about the whole tuberculosis issue and even that example, it's a very practical example of how this can be, expanded. But I think what this bill does, I mean, I agree with you that to some extent maybe it should be brought into where the standards and practices for telehealth and telemedicine are put in statute for any circumstance. But for me, the critical part here is that we don't necessarily need to have it only in an emergency situation. And what I find necessary about this bill, while we can say that it's not being denied right now during the pandemic, if you were to take a time where you want to examine whether it's being denied or not, the fact that it's discretionary on the insurance companies may result in situations where coverage can be denied. And I think that's the part here that many of us are concerned about. And I had a person communicate with me about this bill from a very practical point of view, who also has a child with acute illnesses that has regular follow-up checkups with a specialist who's not on Guam. And this was one assurance to that person that the care for her child would not only be continuous, but that she would never have to worry about whether it is affordable to them. So that's the one assurance that I think this bill provides, is that by putting it in statute, you now ensure that that discretion is removed from the insurance companies. But it also then, because the practices and standards are in place, it also then will allow the provision of telemedicine and health care to be expanded. And perhaps, knowing that it would always be covered, that in itself is an incentive then to increase the use of this. Would you agree, Mr. Kondo, from GMH, and Mr. Chima from Public Health's perspective?
Thank you, Senator Torres. Absolutely. For me, what I've learned in my many years at GMH, especially in the area of emergency management, especially through grants, the grant programs, they want you to use the infrastructure during normal and emergency operations. If you wait till there's an emergency and you haven't practiced this infrastructure during normal operations, the nice thing for us, it's a part of our standard of care. So we get to use it every day. And so that's why when an emergency happens, we're already excelling at it. And so it's easy for us to then use it, maybe only a higher level of it, or maybe a specific targeted area of it. And so it's in this case, I just want to stress that for us, we strive to use telemedicine during normal and emergency operations.
That's good to know. But I know that we also, just borrowing from what Dr. Shea provided in his testimony that the Vice Speaker mentioned, the fact that we're so isolated is reason enough to have telemedicine be a program that we aspire to expand. I would tend to agree with him. Many times when we talk about specialty nurses in the hospital, the access to specialty nurses consulting with Guam nurses, or the access to specialists conducting trainings or instruction to people on Guam is a part of that whole telemedicine and telehealth practice. And I think that's what I wanted to capture is that the fact that it's encouraged to use it on a normal basis so that you're always up to speed is one thing. But I think that Guam being Guam and our challenges with attracting specialists or having enough to service us is reason enough to have something like this in statute so that we know that it's not a discretionary type of coverage and that people will not be disincentivized to invest in Guam or to participate in Guam health provisions. So I just want to make the comment. If you want to care to comment, I'd appreciate it. Thank you, Madam Chair.
Thank you. At this time, Senator Pito Terlai, do you have a comment or a question for the panel?
No question at this point in time, Madam Chair.
Thank you. Thank you, Senator Pito Terlai. Senator Perez, for a comment or question, you are recognized.
Thank you, Madam Chair. Yeah, just a question for the panel regarding, so it's great to see that in response to the pandemic, you've already developed, I guess, procedures in place. But, you know, I guess in regards to this industry, telehealth industry, you know, it seems to be it's in the process of normalization, according to my impression. And, you know, what is your take on some of the safeguards in ensuring that, you know, the healthcare is, a standard of care is actually provided to the patient? If you can expound on that.
So clinically, we have a team of telemedicine technicians who are side by side that ICU intensivist that is doing telemedicine basically. And in the hospital, we, to measure our performances with clinical procedures and things like that, we use performance indicators. So certain indicators are created for the program itself, which is our Gmh telemedicine program, and we intend to expand those indicators and watch out for incidences and improve upon them continuously.
Thank you. And is this procedure used widely, or CDC? Is it CDC approved, or do you go by a certain protocol that's recognized nationally?
So we do have one of our vendors, Innovator Health, is more experienced in providing these services through different parts of the country in the United States. We seek guidance from them, as well as we do research on the procedures that we take, on how we see patients and how we take care of patients and what we have to watch out for.
Great, thank you. And so Hipaa Protections is also included in this?
Absolutely. Everybody is subject to HIPAA disclosures and statements from our patients as they walk to the front of GMHA. They sign those disclosures, as well as all of the physicians and everybody involved in the program.
And also the level of cybersecurity to ensure HIPAA. Is that, you know, what is the investment that's needed for something like this?
If I may add, ma'am, the current pandemic now, CMS issued waivers regarding telemedicine infrastructure. In a normal situation, the security is really tight as we know it. HIPAA compliance is always top notch. But because of the current pandemic emergency, it was relaxed a little bit. So telephone conversations or consultations now are allowed. Even non-HIPAA compliant platforms are allowed to be used. But as far as GMH, we tried to stay within the approved HIPAA compliant infrastructure, both for inpatient and outpatient services that we have implemented, because we don't want to revert or change it down the road as the emergency situation softens.
Okay, thank you. And I just want to maybe ask a question regarding to the bill that's specific to the bill. So there are exceptions to the use of, I guess, telemedicine, and I guess in response to emergency conditions. And then there's also goes into advertising or sale of a commercial appliances or remedies. And then also regards to use of massages, steam baths, dry rooms, infrared heat, UV lamps. So there are others that are listed in the bill, and I just would like your maybe suggestions or response to the exemptions. In my copy, it starts on page 7 and it goes on to page 8, section 29306.
We don't provide those services listed there under your exemptions. Ours is purely clinical, taking care of the patient, and all that's involved in that.
Do you think you'll see a need for these other exemptions?
No, not at this time.
Okay. Thank you so much. Thank you, Madam Chair.
Thank you, Senator Pierce. I apologize. Senator Joanne Brown, do you have a comment or a question to the panel?
Thank you very much, Madam Chairman. I can understand, certainly during public health emergencies, perhaps the need for this, and with our modern technology, how this can be more available, especially where you don't want or have the capacity, like in the hospital or clinics, especially certainly something as contagious as what we've experienced with COVID. But I think it would be good to clarify, because one of the things here, I can see the benefits, certainly, we're living on Guam, how this can be expanded if we weren't just in a public health emergency and we needed a specialist, for example, that is off island. We don't have the population that would accommodate, all the health specialties that we'd like to have here on Guam where this can be used. But one of the things that it says here on page 4, subsection B, with regards to the telehealth provider may use telehealth to perform a patient evaluation. If a telehealth provider conducts a patient evaluation sufficient to diagnose and treat the patient, the telehealth provider is not required to research a patient's medical history or conduct a physical examination of the patient before using telehealth to provide health care services to the patient. I'm just looking at the other side of the coin here with regards to what does this open up for liabilities? Normally you would think, would you have a healthcare provider on Guam, for example? I know we're talking about emergencies, but I see where this can eventually go to. Where you need the assistance of a specialist. Are they working hand in hand with the patient's local physician, or can this simply the patient interact with I know we use the word telehealth, but a doctor off island through this process? And then what's the legal liability because they've not examined a patient to confirm? I'm not a doctor. But that's normally a process, at least has been in my experience, to try and assess a condition a patient may have. It's pretty routine to want to take, tests in some cases. Sometimes they require your blood test or other things, for example, before they see a patient. Because there could be, again, I'm not a medical expert, there could be similar conditions a person may have that could be related to different types of ailments. We're not, sometimes you go down the checklist and then sometimes you can get surprised. So I'm just curious about that aspect of it. And what's the legal liabilities? Is something that at some point, I don't doubt, will be litigated if, you go through this telemedicine process and a physician who has not examined a patient comes to one conclusion, and then let's say the patient gets ill or dies from something else while they're seeking, medical assistance for something. But that's the real world. So I'm just curious, has that been looked at? Because if it doesn't require a physical examination or concurrence with a doctor on island that perhaps has done a physical exam that they can reference. Are we rolling the dice in some cases?
Thank you for that question, Senator Brown. In the case of GMH, our telemedicine physicians from off island, though they are speaking directly with the RNs on our side, like in the case of our ICU nurses, it's also in collaboration with our hospitalists. Mm-hmm. So we don't have enough coverage of our ICU physicians, our intensivists, because like Dr. Uggan might not be able to be there 24/7, but they have direct access to our hospitalists, also our anesthesiologists. So if there's so they have direct access to the physician, the exam, the whole provision of care, the care plan of that particular patient. They have access to that, so they're not coming in blind. They're being they have all of those summaries, and if there's any question, they're collaborating with other physicians on our side, and so it's still a pretty robust team of professionals. It's not just the physician, on the other end in California by themselves.
So you're looking at it in a controlled environment just between GMH in a medical emergency? Is this what, I just want to make sure what, to the parameters of what we're defining this as. This is not something a patient can go to a medical clinic on Guam and interact with at this point? You're simply saying this is only limited to GMH?
Oh, no. I mean, so the ICU is just one example.
Okay.
We are also starting to branch out to other services. We see other services like outpatient services. We want to be able to have it's almost like a form of telemedicine, only local with public health clinics, even with the private clinics. We want to be able to basically connect the entire network eventually. It's just we're not there. It's going to take time for us to get there, but that's our vision. And as we go forward in that process, of course there's going to be things that you're talking about, like liability issues, all that stuff. We're going to have to carefully look at that.
Yeah, I would think so, because if it's GMH, it's the people of Guam that are going to be paying for those liabilities. So obviously we would be concerned about it. I can see the positive upside and the benefits, certainly. But at the other end, I think we also need to define that and what's the scope of that. Mm-hmm. Because of course, I mean, when it comes to health, obviously, I mean, if you're the patient and you're misdiagnosed and let's say your condition worsens and perhaps you're debilitated as a result of it or you die from it, obviously there's going to be a concern. Is this something that you're looking at implementing as well with the private hospital, as you mentioned? You're looking at eventually maybe expanding this out so that you have a whole network, I assume, to respond to public emergencies such as what we've experienced this past year. I mean, COVID is our most recent evident example of that. There are other things or other versions of COVID perhaps that can come in the future. Is that what you're looking at networking this for?
Mm-hmm.
Yeah, I just wanted to comment on your previous question as well. But we do work as an interdisciplinary team. In the ICU, we have rounding. We round with a whole team that includes a pharmacist or a respiratory therapist, the hospitalist that's on site, the telemedicine technician, and as well as the intensivist that's telemedicine. So the telemedicine physician also has access to our electronic health record, as well as our radiology images, all of the lab results remotely. So they have the full picture before they make clinical decisions on each and every ICU patient that they see. As well as they do individual rounds with each patient. We have high definition cameras that we point to the patient itself. And we also have a stethoscope that they can listen to the patient's heart and their lung sounds. So that has been amazing to see. So they really are I think they spend more time than the regular physician inside of that ICU bed and see that patient. So I think we're definitely looking at the practices. We've been in it for about 6 months right now, developing workflows inside of the ICU, and we wanted to pilot it in that place first before we expanded out to see what the workflows look like clinically.
I appreciate the explanation, but I have to tell you, in reading the bill, I don't see that. I don't see any reference to what those standards are, except this language that tells me that someone providing telemedicine expertise doesn't have to examine the patient. I don't see anything that references that we require a certain standard of preliminary examination that's happening locally, or everything you just said to me. I don't see it in this bill. or referenced in this bill. And I think that would be helpful so that we have an understanding. And certainly when we get back to the law, at some point it ever gets to be an issue that is challenged, then, or even for us voting for it, then we would have some comfort that there's something else other than this language on page 4, item B, that says there's no examination. So if I'm just simply going to go on what I'm reading in this bill, I'm very uncomfortable with it. Because everything you said in terms of protocol, I don't see it referenced or any type of healthcare standard that is referenced where it shows that the patient or patients are within the care of a local physician or ICU or whatever the case may be, and that it's not happening just one-on-one remotely without that type of hands-on care, so to speak, involved. So I think it would be helpful to include something that references that standard structure in here, and again, this language makes me uncomfortable. It really makes me uncomfortable. Like I said, I'm no doctor. I'm just putting the pieces together, being a patient, and what certainly my expectations would be for healthcare. So I see the upside, but I think that issue needs to be further defined in terms of relaying in the bill, which if the desire has become law, that these other questions that have been raised here are addressed by some section that references whatever that standard is that you just mentioned, the overall review, coordination, monitoring that's going on with the patient. I'm sure there's some medical procedure or standard that you can reference that they're meeting this while this is happening or while patients being treated, so that we have some comfort that the patient has been examined and their vital signs are monitored and that this is the right direction of care. Especially, like you said, if we're under an emergency circumstance, a crisis circumstance. But you know, I'm sure every patient to you is just as valuable as every individual who is a patient in terms of the quality of care that they would like to receive. But thank you very much for your input. Thank you very much, Madam Chairperson.
Thank you very much, Senator Brown. And I will, at this time, allow the author of the legislation to close with or comment on her bill, but more importantly, to address some of the concerns that my colleagues may have brought up. I do know that one of the concerns, his item is listed on page 8, item 2. So I will yield to the author of the legislation, who was my vice chair. Please proceed.
Thank you very much, Madam Chair. And just to address the last concern, I was discussing up here with the chairwoman that there is a provision in the bill under the section of exemptions that reads, in consultation with a healthcare professional licensed in Guam who has ultimate authority over the diagnosis and care of the patient. So that is a safeguard that we did include in the bill, but we will discuss further if there's a way to make that clearer and strengthen that for us, as well as in section 29303 that was referenced that if a healthcare provider conducts a patient evaluation sufficient to a diagnosis, if they're able to diagnose without any physical examination, that is when that scenario would play out. But we do have this provision on page 8. It is line 1 to 3, but we will definitely see how we can strengthen that to alleviate some of those concerns and ensure that we're protecting our healthcare professionals on Guam and our patients on Guam and keeping them protected in that way. And I'd also like to just thank everyone for being here today, for giving your afternoon to provide testimony for this bill. I greatly appreciate it. To the Department of Public Health and Social Services, to the Guam Memorial Hospital Authority, thank you very much, as well as I believe Dr. Shea, who provided testimony, and Mrs. Maria Espinoza as well. And I'd like to thank the chairwoman for hearing this bill, and I'd like to note for the record that we did work together to invite the insurance companies today to provide their input, as they did in a previous version of this bill during the end of the 35th Guam legislature. So we will solicit their input once again for the committee report. And with that, Madam Chair, again, thank you, and thank you to all of our colleagues for the time today.
Thank you very much, Legislative Secretary and author of the legislation. I will also note for the record that a request for a fiscal note was sent out to the administration, and as of April 12th, there has not been a fiscal note submitted back. And I will continue to have the committee do a follow-up to make sure that that provision is sent out that note is sent down our way. So with that, if there's no one else to testify at this public hearing, I will note that the Committee on Public Accountability, Human Resources, the Guam Build-Up, Pagotnya Revitalization, Regional Affairs, Public Libraries, Telecommunication, and Technology has publicly heard Bill number 103-36. I will share with the listening audience. All those who wish to provide written testimony can do so by emailing it to Senator Muña Barnes at guamlegislature.org, or they may send or hand deliver it to our office here at 163 Chalan Santo Papa, Hagåtña, Guam 96910. And as I noted that this public hearing is duly heard, I will adjourn this hearing at 3:20 p.m. Si Diyos masi, si Diyos on binidisi hamdul todos. Sana masi. Thank you.